2022. Today, we're focusing on the state of men's health in Australia in 2022. This is the second session of the day, and we are going to be focusing on the impact of the COVID-19 pandemic on men's mental health. Clearly, it's been the #1 health issue in the last couple of years, and we have 4 excellent researchers who've spent a lot of time speaking to a lot of men and going through a lot of data, which they're going to share some of the highlights from today. So for those who don't know me, I'm Glenn Poole. I'm CEO of the Australian Men's Health Forum, and we're your hosts for this week's Men's Health Connected. We've got a variety of different themes throughout the week. Tomorrow we're looking at exercise and men's health, with a particular focus on some great men's health projects that are using exercise to improve men's mental, physical and social well-being. We've got a focus on Wednesday on running men's health events, with again a number of great men's health projects sharing their expertise and experience in the field. We have a focus on men's lived experience in our Hearing Men's Stories session on Thursday, and on Friday we'll be running some workshops just especially for people working in the men's health sector, one with a focus on suicide safety planning and one with a focus on presenting events or talks to men about men's heart health using our own Know Your Man Facts toolkit. Now you can register for all of those free or share the links with your friends on the Men's Health Connected website. But now, session 2 and our final session of today, COVID-19 and its impact on men's mental health. Joining us today, we have Jim Reid of Resolve Strategic, Dr. Zak Zeidler of Movember, Dr. Neil Hall of the University of Western Sydney and the Centre for Male Health. And I don't know if she's in the room yet, but also joining us will be Dr. Jackie Mcdonald, who is at Deakin University, key person of the Australian Fatherhood Research Symposium, but also been running the, she's there. Hello, Jackie.
Hi, Glenn. Sorry to scare you.
No, that's all right. I completely trusted you to appear at the right time. The lead researcher behind the Men in Parenting Pathways longitudinal study. So what we're going to do is each of the researchers are going to share some highlights from their research, sort of orientate you into an understanding of what they've been looking at and what they've found, and then we'll open it out into more of a sort of more of a discussion. As we sort of picked up earlier in session 1, COVID-19 impacted everyone and continues to impact people. There's no doubt about that, and we're having a particular sort of focus now on some of the ways that the pandemic and particularly the pandemic response impacted the mental health and well-being of men and boys in Australia. We, as the Australian Men's Health Forum, as I mentioned this morning briefly, were commissioned to do some research by the National Mental Health Commission, and Jim and Neil are sharing some of their findings from that work. The work that Zak and Jackie are sharing is independent of the research of the Australian Men's Health Forum. So it's a great opportunity for us, having not completed that research yet, to sort of share the findings and see where the similarities or the differences are in the stories that are emerging. So I'm going to introduce Jim Reid at Resolve Strategic first. Jim did some great research with us last year, looking at public attitudes towards men's health, which is really useful in terms of us shaping the way that we talk to politicians about men's health as an issue. We thought it'd be really interesting in this piece of research to get him to give us a kind of a population level snapshot of what both men and women thought about the impacts of COVID-19 on men and boys from their experiences as a starting point for our research, to get that broader kind of population response before we started to delve down into sort of research into what the sector was telling us and then what individual men were telling us. So I'll hand over to, and Jim's got a long background working in social market research and has been involved in many successful election campaigns. So he's probably taking a break from some very important work with the small matter of a little election that's going on at the moment. So we're very blessed to have him. And if you're lucky, he might actually tell you who's going to win the election as well. But first, let's get him to share his findings around Australia's thinking on the impacts of COVID-19 on men's mental health. Over to you, Jim.
Right, thanks, Glenn. I don't think I can add any more to my introduction, that lovely introduction. So listen, I'll head straight into it. I think we've got 5 or 10 minutes for each of us to talk to you about our research. So I'll perhaps forego, detailed slides and other things, and just talk to you about 3 or 4 observations we got from our research. And that's not only the research we've done for the Men's Health Forum. We've also done research for the 9 newspapers for podcasts like Enough on mental health amongst young people as well. That all our research includes big polls, obviously, but also one-on-one qualitative interviews with people. I guess my first observation would be that the area that you all on this screen are working in is an important one. Don't let anyone tell you otherwise, or a lack of it being on the front page for a day or two tell you otherwise. When we ask people to nominate important health and social issues, we collated 14 of them. Mental health was joint first place. And bearing in mind that our poll was in October, November last year at the height of COVID lockdowns and Omicron coming over and all that sort of thing, it was joint first place with the health effects of COVID. So you're working in an incredibly important place. It was rated as far more important than nurses and doctors and staffing levels, domestic violence, and a lot of other things. This is an issue that people have started talking about in our research. And it's certainly an issue that perhaps in years gone by, had a certain stigma to it. People are now talking about it, okay? So you're working in an area that not only is important to those coping with mental health issues but those helping them, it's important to all Australians and by extension our governments as well. It's an area that everyone wants to address. Why is it so? Well, very simply, people told us that if they weren't personally suffering with a mental health issue, they can certainly see it all around them. Their colleagues at work, their friends, their family. And because we're talking about men's health here, that includes connections like your father, your brother, your husband and your son. People, it's equally important to women as it is to men. We used various methods of asking people if they had been affected by mental health issues, and half of people said they had. They'd experienced stress, anxiety, or depression in the last year or so. So certainly it's a big issue. We use the DASS diagnosis tool, which found that 25% in our survey had experienced severe mental health within the last week at that time. I'll just repeat that for you. With the DASS scale, a quarter had experienced severe mental health issues within the last week. Wow. My second observation is, it has got worse, during COVID. I think we all know that, either anecdotally or through other bits of research, but this bit of research absolutely confirms that. It's had a very significant impact. In effect, it's turbocharged what was already happening. Those DASS ratings that I spoke of are typically collected on a 10-point scale, and comparing our nationwide survey of 2,000 people against pre-COVID benchmarks, the average 10-point ratings for anxiety and depression in particular had doubled during COVID. Let me repeat that, they had doubled. When we asked people just have, suffering any, mental issues at all, how had they fared during COVID, just a quarter of those people said that they hadn't had an effect. they'd had long-standing issues that had remained the same. The rest had either had existing issues exacerbated and just as commonly come across new mental health issues. So there's absolutely no doubt that the COVID's had an impact here. But interestingly, it wasn't about the illness itself, or very rarely so. It wasn't about, either catching COVID or being scared of that in most cases. It was actually about the consequences of the cure, notably restrictions and lockdowns. So when you think about your life being restricted, you can't socialize how you once did. You can't see colleagues at the office. You can't study in the classroom. You can't play sport. You can't go on a short break. You can't have a beer with your mates down the pub. You can't go to the gym. You can't go to a sporting event. That can all cause physical problems. In fact, I've become a bit more portly myself during COVID. But it can also cause relationship breakdown, lost careers, failed education. And everyone was basically telling us that I felt more isolated, not in control, guilty for my kids, perhaps. I've had a lack of purpose, increased pressure, worry, all those precursors that you'll be well aware of. And those effects weren't evenly spread. I think somebody said in the session before me, I cheated and came on a bit early. We were all affected, regardless of sex and age, over the last couple of years. That's absolutely true. But we tended to find places like Melbourne had greater effect than, or incidence than, places like WA or Queensland, for example. And the effect was higher amongst those on lower incomes or requiring government supports for obvious reasons. They'd had trouble at work and financial concerns. But the biggest, sort of disparity in effect is with young people, by which I mean, in our surveys, teenagers into the early 20s. We didn't survey children. They were suffering more commonly by their own ratings, at about double the rate of older people, and more severely too. To give you one example of that severity, 25% of the young people we surveyed reported thinking and considering suicide, thinking about and considering suicide. 1 in 4 young people considering suicide. I've come across, in my 25-year research career, I've come across some scary stats. That's probably up there as one of the scariest. Okay. In terms of differences by sex, at first glance, mental health issues were pretty common in both sexes, male and female, as was those being triggered by COVID. There were some differences by age and sex, younger girls being affected differently to older men, for example. But the way it impacted people and what they did about it was different. First of all, men reported that they'd been more affected by many of the physical and practical impacts of COVID and restrictions, like having to change their working patterns, working fewer hours, losing their job even, attending events less often, like sporting matches or going to the pub or going to the gym or whatever it happens to be, looking after the kids more often than they did in the past. So their lives had changed practically more than women were saying. However, despite those fewer practical changes, women were saying they were personally impacted more. So on almost every sort of emotional scale we had, they were more worried, more frustrated, felt less in control, were less certain, were more lonely, were more fatigued, more burnt out. So we have this odd flow chart, if you like, of everyone being affected by COVID, but men saying they're more practically affected, women saying they're more emotionally affected. But at the other end, they were all suffering some sort of stress, depression, or anxiety. One way to interpret that, and I think this is perhaps riffing off what some of you have said in the earlier session, is that women can more readily react in an emotional sense and share those feelings. They have that voice. Men, through either not recognizing those feelings or admitting to them or sharing them, and they do say in our survey they're less likely to have shared than women, showing that frailty, if you like. They tend to wait until it's a real problem and then take a deeper dive at the end. And my final observation before I hand on to somebody more learned in this area than I am, is to say there's a light at the end of the tunnel here. We do see optimism for the future. They see COVID ending and end to COVID and things returning to normal. So at least some of that growth in mental health issues caused by COVID may come to an end. That doesn't obviously address what our current state of affairs, though. The obvious way forward is support programs, whether that be formal professional support or group activities. And we hear lots of talk about Headspace and mental health hubs and men's sheds and Top Bloke and all that sort of thing, and welcome and well deserved that attention is. 80% of Australians, by the way, in our survey agreed that government should be doing more to support that sort of thing. And they're more than happy to have wide-ranging supports, anything from physical and professional support to information campaigns to less formal support. They're not about the public. This isn't about prescribed solutions, and they're certainly not about identity politics where we're fighting women for funding and vice versa. They're simply saying, look, if we've got a big issue here and a broad solution isn't working for young women or older men or whatever the group happens to be, let's find a more targeted, efficient means and let's fund that. They're very simply saying, let's find out what we need to do, find out the gap, and let's do it. And the very last observation, because I'm probably going over time here, is that perhaps not the most important finding of our research, but one of the most interesting findings for me was when we looked at those people most affected by mental health issues, and we know that restrictions and loneliness and isolation are a big factor here. It was actually those people that lived alone, and mainly young people that lived alone, away from their family or partner, that had lower incidence of mental health issues. Whereas those people who had wide, sort of social media network, relationships and other things, were more prone to what was going on, particularly, young females and the LGBTI community. And that's sort of counterintuitive, but how I'd interpret that is there's a certain resilience in learning to live on your own and away from your parents. That is, with age and experience, you breed resilience. And there may be certain innate and learnt factors there. For example, a lot of people that said they hadn't encountered mental health issues were doing preventative stuff like sports participation and education, all that sort of thing. So I'll perhaps leave you with a question rather than a statement, which is, if there's a resilience out there that's innate or learned or experienced, can that be used and emulated into the future? Thanks.
Right. Thank you, Jim. Great food for thought. Just remind us, how many Australians did you talk to?
The main survey for you was 2,000. We did another, I think it was 1,500 with young people as well through a separate study.
Great. Yeah. So that's coming back from thousands, research into thousands of the views of thousands and experiences of thousands of Australians that are broadly representative of the population. So yeah, thank you, Jim. Really good food for thought. So moving on, our second speaker is Dr. Zak Zeidler. For those who don't know, he's a clinical psychologist, a researcher, and a leading voice in men's health, particularly men's mental health. And his main roles at the moment are he's the director of mental health training at Movember. You've probably heard of Movember, and he's also senior research fellow with the Youth Mental Health Project Origin at the University of Melbourne. Zak, over to you.
Thank you, Glenn, and lovely to see everyone. Feels like coming home whenever I get to do these things. Lots of familiar faces. Jim, you've mildly re-traumatized me with those statistics, so thank you for that. We're back in the depths. It was a rough time for everybody, no doubt, and it's been a very interesting thought piece, I guess, and the way that we've responded as a society to what has been an unprecedented, and that word has been overused, event in our history now. From a mental health and a men's health perspective, I've been intrigued at how things were going to go and what was going to happen. And I'll talk you through some of the stuff that we worked through, my team and I think a few of them are on the call, and I've been very lucky that, you know, most of you know how the sector wraps their arms around you, and we've been very lucky to be growing year on year. And if anything, throughout the COVID times, I think we all found stronger bonds, the researchers and clinicians in this space as well. So I think what happened at the start of this pandemic was that there was a lot of alarmist language going on. And there were plenty of clinicians and researchers perpetuating some of this stuff, trying to, with the best of intentions, point out the importance of the mental health dialogue in what was going on. There was talk of a shadow pandemic, and the fact that there was, you know, all of this mental health burden that was going to come and follow the physical health burden of COVID. And there was also a lot of talk, obviously, about the mental health sector, you know, being understaffed. There was also a lot of talk about the fact that we actually don't know what impact these lockdowns are going to have on youth. And Jim has obviously just told us it didn't leave them in the best space. In saying that, I'm not sure. I'm hoping that most of you know that the suicide rate actually took a 5% dip in 2020, and 2021 stats that are yet to come out. And there are a number of reasons for that, I believe. And I think that it says a lot about resilience, which we were just speaking about before. It says a lot about connection, social connection, which is a topic very close to Movember's heart and my own as well. And I think it fundamentally saves lives. And you've seen a regrouping and a for some reason, community has come back to the fore, whereby people were literally leaning over their fences and having a chat with their neighbour whose name they didn't know the day prior. And so you ended up in this strange society where we're going back to, you know, the olden days, where suddenly people are meeting in cul-de-sacs and having chats on their front balconies and talking with one another in ways that seemingly technology had gotten rid of. That meant, I think, in some ways that despite a suicidal ideation going up and up and up, and I want to, you know, I'm not here to suggest that this was a fun time for anybody. There was a lot of distress going around. My wait list, my clinical wait list blew out, you know, to 6 to 9 months. There were endless referrals coming in from every angle that you know, most of the clinicians in Australia were unable to respond to. And Lifeline obviously had a huge bump in numbers as well, and in male callers specifically. But nonetheless, I think the fact that people were at home, were with their families, were faced with the joint challenge, I guess, in many ways, of COVID, meant that there was a normalizing of the mental health narrative. That is to say that there was a belief, I think, amongst many men. So we surveyed 2,500 guys in March of 2020, so just as things were starting off, and then we did another survey of 2,000 to 3,000 again in 2021. And we really did find that despite the fact that distress was very high, coping mechanisms and social connection and desire for resiliency were all much higher than previously. And so it kind of suggested in many ways that it was okay now to talk about your mental health because everyone is having a shit time. And so all of that idea of I don't want to be a burden, I don't want to talk about this thing when no one else is talking about it. Well, suddenly everyone is bloody talking about this. It's everywhere. It's like you call someone, you're on Zoom. In 2019, you're on Zoom and you ask someone how they're doing. If they say, I'm horrible, it's fucking Groundhog Day, I don't want to do this again, you'd be like, oh, what's going on? In 2020 and 2021, everyone's doing that on every call. And suddenly there's an acceptance of discussing, for instance, depression or anxiety in a commonplace way, which was, I think, I'm trying here to point out the fact that there were some very fast moving, that progress when it comes to the way that we speak about mental health. I think our youth, while again going through extreme distress, were able to vocalize some of this stuff. The problem is that the health sector was not willing or able to match the amount of distress that was on display. So while there was an outpouring of distress, and we keep telling people to reach out, I'm sure many of you heard of my repeated mantra, which is that, we keep telling men to open up, but are we actually ready to listen? And we found during COVID, more and more men were opening up, were describing their emotions, were accessing what was happening in their everyday life, and were unable to get the help that they needed and that they deserved. And so you end up with this serious issue where our system is not catering to those most in need. And I believe that we are not out of the woods yet. I think that COVID in many ways acted as somewhat of a protective factor for suicide, in that there were police roaming around everywhere, to be honest with you. That seriously had an impact, and the fact that people are stuck at home. There were lots of various reasons, and we're currently undertaking a study looking at protective factors, with a couple of thousand guys, asking them what kept them going, what kept them alive in many ways. So the results of that will be coming out soon. But the notion of coping, of accessing resilience, of being able to understand the fact that there are so many people who are lonely right now, the fact that the media is reporting about mental health challenges on a day-by-day basis, I think reinforced to many that they were not alone, despite feeling very lonely in some ways. So I do hope that there are some lessons that we can take from what happened. Nonetheless, just like Jim said, he found that 25% of his sample, young sample, were suicidal, or showed suicidal ideation. We had up to 50% of our male sample showing suicidality. This is both a black box and also an extremely common experience that is not being spoken about. And you have to ask in a very certain way to be able to garner the right answers, I think, from many men. And that's something that I like to think our team is getting better at over time. But there was a lot of disgruntled men talking about the way that the government has responded to this, and the way that it has curbed their ability to work or whatever it may be. And despite the distress being very high, I was really buoyed by the amount of communal togetherness that I saw. So I'm gonna leave it on somewhat of a positive note, because I think that there are learnings here, and we are here to talk about mental health. And mental health is the ability to persevere and to find that resource internally. And hopefully there are some things here that we can learn on together and grow as a sector as well. So thanks for having me, Glenn.
No, great. Thanks for being here as always, Zach. Lots of great food for thought, and a good reminder to actually reflect on some of the positive outcomes that are emerging from what has been a very negative and unprecedented experience that we've all been through. Move on to Dr. Neil Hall now. Neil will be known to many of you in the men's health sector, based at the University of Western Sydney, but you'll know him, many of you, from his work with the Men's Health Information and Resource Centre, that we sexily shorten to MERC. And I think you're now called the Centre for Male Health, but you'll have to confirm that for me. But the point is, whatever you call it, Neil has a very long track record of focusing on the health and well-being of men and boys, with a particular focus on the social determinants of men's health, and has undertaken a number of different research projects in recent years on men's lived experience of mental health and suicidality, and in particular, just in the last few months, has been having that conversation in the context of COVID-19 as part of the research project we're undertaking. So over to you, Neil.
Thanks very much, Glenn. Yes, MERC is now known as the Centre for Male Health, as we have a a bit of a, in true Western Sydney University style, a bit of a rebrand. This time we're not spending $14 million on changing the name. However, we thought it was time to I think expand more broadly across the university and pull together a lot of people that are beginning to research into areas of maleness and male health, men and boys particularly. The project, the research project that we've been working on is part of what Glenn mentioned as funded by the National Mental Health Commission. So in partnership with Resolve, AMHF and Centre for Male Health, we've been exploring different levels and different aspects of how COVID is impacting on men's mental health. Our part of the project was to try and focus a little bit more on men as fathers, men who are in male-dominated workforces, men who see themselves as family providers. And we decided that to sort of value add to the project, we would concentrate on some selected social determinants of mental health, which were, you know, there are a lot of them. We decided that we'd think about the nature of employment, family relationships, financial situation, social emotional support, and to some extent gender identity. So in doing that, we have conducted surveys and in-depth interviews. I'm going to try not to go too much into the breakdown of who we saw, who we spoke to, because that could take up a fair amount of time just talking about the characteristics of the cohort. But we did have respondents who were between the ages of 21 and 88. And so therefore, obviously, some who were retired. About 40% people employed full-time, 11% people employed part-time, 7% unemployed at the time of contact. We also had about 70% of people who were reported as being able to work from home during the pandemic, of those who did work. In terms of men as fathers, the average number of children that people had was 2.1. How you have 0.1 of a child, never quite know. But the median age of those children was between 6 and 12. I think one of the things that we were particularly interested to know was knowing that employment is a significant factor in somebody's mental health and suicidal ideation, or not so much employment, but unemployment and underemployment. We wanted to know what had happened for people with their work and how that impacted on their mental health. So over the course of the period that we were talking about 20% of our respondents had lost their job during COVID. 31% had a reduction of work hours, and about 15% had changed their job. About 60% had their income had been reduced during COVID, and around about 22% had started receiving the government's crisis payments. One of the things that we thought was also important to know was how it might have been, how the pandemic may have been impacting on their relationships, because we know that the quality of relationships and therefore relationship breakdown is a significant social factor in mental health and suicidal ideation. There was some interesting findings there. We had about close to 60% who actually reported no influence on their relationships. So we kind of breathed a bit of a sigh of relief in that regard. 15% had about about 15% had some intimate relationship breakdown during the pandemic. And around about 18% actually reported that their intimate relationship had changed for the better. And I think some of the reasons for that was that they actually got to spend more time together. And they were able to make decisions together related to their children and share in some of those parenting responsibilities. You know, a significant number of the men we spoke to reported reported their relationship with their children having changed for the better. So about almost half had said that the relationship with their children had changed for the better. You know, with lockdown, I suppose, they got more involved in homeschooling, for example. With more time on their hands and being at home, they're actually able to do things together. Whereas for a lot of men who commute to work, you know, they spend in a non-lockdown period, for example, they may spend 2 hours a day or more getting to and from work, and that's not counting the number of hours they spend at work. So more time available, they reported, meant that the relationship with their children and their partner had improved. What this meant for their mental health, I think, was interesting. We did have about a quarter who participated in the research reporting a pre-existing mental health diagnosis, and that's probably partly due to some of our recruitment procedures. We had found, and we used the K10 scale rather than the DAS in our survey, but we've had found that about 30% of the men who responded felt nervous, hopeless, restless, depressed, that everything was too hard and worthless, more than usual during COVID. So it had a very significant effect. And this was particularly the case during lockdown periods. That was heightened, most particularly during lockdown. A lesson, because of the timing, I think, of when people respond to the survey, there was a bit of up and down in terms of people's responses on the K10 scales over the last 30 days, but reporting, reflecting on the entire period of COVID, that COVID's been around. Yeah, we were looking at close to 40% of all people reporting that it had impacted significantly on their mental health. What was another interesting finding was that, and this is not on any of the scales, but we asked whether they felt confused. And again, we had almost 40% of people saying they felt confused almost the whole time during COVID. And that's no surprise, because all the public health messages, all the government policy responses and procedures that we were required to follow were full of confusion themselves. In terms of how people coped, we were finding that people reported walking and often having to walk alone, eating better, and reading. Reading people were the most common coping strategies. About half reported having talked to family and friends about their experiences, situations, including, as Zak said, neighbour over the fence or on the street, on the front curb. 20% reported having spoken to GPs or other health professionals. In that, remote service delivery was seen as necessary, but those who felt it, who did use it, felt it wasn't anywhere near as good or effective as being in person. We also found that help offering was becoming more common by men. Just sort of reflecting on something that Glenn had said earlier. So not just talking about help seeking, but help offering. And men reported having been in positions to offer help more frequently, but that was not necessarily reflected in help receiving. So, and in fact, around about 32% of our participants reported not having spoken to anyone about what they were going through. There are a number of reasons, and I feel like I'm getting to my time here, and I did want to end on something positive, but these are really sad, these points, is why people didn't talk. They didn't feel like their feelings were worth talking about. They're used to keeping things to themselves. They don't feel comfortable expressing their emotions. I think that and they weren't in big numbers, but it does reflect that whole thing of, the stereotypically male approach. And we've been saying all along, and through this project and through other research I'm doing and through other research that other people are doing, that yes, men do talk. They just got to be asked the right question and asked the right way, and given time to respond. And as Zak's mantra, find people who are willing to listen. So yes, I think we're getting a pretty clear picture of the impact of men's lived experience of mental health during COVID.
Wonderful. Thanks, Neil, for what you've added to the picture there. Each layer sort of builds more richness, and we'll move swiftly on to the final piece of the jigsaw in terms of this panel, to Dr. Jackie Mcdonald, who some of you will know from her excellent work leading the Australian fatherhood research group. I've got the last word wrong now, haven't I? Consortium, and also the Australian Fatherhood Research Symposium, which I'm ashamed to say I didn't make it to this year, which is a wonderful annual event usually held in May, and you should all go to it, including me. Jackie is at the Deakin University and heads up a longitudinal study on men and parenting pathways, which has enabled her to do some really interesting comparative analysis with her cohort. So over to you, Jackie.
So Glenn, unlike the others, I'm going to share some slides only because I tend to be a person who goes off on tangents if I don't keep the slides. So
good.
So let's just try this. How's that look? Yep, great. All right. So as Glenn said, that I oversee a program of research at Deakin University called Men and Parenting Pathways. So MAP is an investigation into men's mental health and wellbeing, how it affects and is affected by family life. And it includes how men prepare for fatherhood, how they manage their relationships, their work, the emotional changes of parenthood. But we're also really interested in men who decide to not have children or who are unable to become fathers. And we're interested in family life, not just as the new families that they form, but their families of origin and however they understand family for themselves. And right from the outset, we actually planned 5 annual waves of data. We recruited 608 men from around Australia, starting back, the recruitment actually went from 2015 to 2017. And the men were aged at the time of recruitment 28 to 32 years, which is just before the peak age for entering fatherhood in Australia. And we'd completed 3 waves in the midst, and we're in the midst of our 4th wave when COVID hit. So we quickly shifted gear and set up a COVID survey, and we recruited 286 participants from our original MAP cohort to follow through COVID. So this is a bit of a timeline giving some indication. In March 2020, At pretty much the same time as the national lockdown directive to stay at home, we launched our first 15-minute survey, an online survey, and we kept it open until mid-May. Then subsequently on July 8th, Melbourne went into stage 3 lockdown. And then on July 20th, we launched our second survey just prior to going into those stage 4 restrictions in Melbourne in 2020, where we had our first limit to a 5-kilometre radius. And we kept the survey open till early September, but it wasn't actually until about October that Victoria's lockdown ended. Then again in 2021, our third survey coincided with the Sydney and Melbourne lockdowns and also with my house renovation. So of the 286 men who agreed to be part of the COVID sub-study, we had 31, they were at the time of the first COVID survey, 31 to 37 years old. 62% were fathers, although a number then became fathers during the course of the pandemic. 43% were from Victoria and 23% from New South Wales, the rest from other areas around Australia. They were a reasonably highly educated group, but with 87% having completed at least year 12. And a quarter of them at our first time point were finding it hard or just getting by financially. So just also to give a glimpse of the mental health context, I think we've even heard it here. There've been actually quite a few mixed findings about changing rates of mental health problems during COVID. And we think this is because of the changing conditions like working from home suited some people but were detrimental to others. And so this meant that some people did much worse over COVID, others actually did better. And the average levels of mental health in some studies seem to be cancelled out. They looked the same because extreme ends of each other cancelled each other out. But when we digged a little bit deeper into the MAP study, we could see that those with existing mental health problems were very likely to experience an exacerbation of symptoms. I think that's similar to what Jim was saying earlier. And the MAP study sample actually already had higher levels of mental health problems in comparison to the community generally. But we can see from the graph that's on the screen that at the severe end, there was this substantial increase in symptoms of depression, anxiety and stress, particularly anxiety and stress, across the course of 2020. And while there was a decline from that peak, when we went into 2021, the rate of men with extreme symptoms remained much higher than at the beginning of the pandemic. So overall, we've been really interested in understanding factors that are related then to mental health and in particular coping, loneliness and help seeking. Yeah. And there's been a lot to cope with, more for some than others. Here's one fellow from our study telling us at time 3 in Victoria. He said, my mother passed away in April and we also had a 10-month-old baby. Our families are based in regional Victoria and we're in Melbourne, so we haven't been able to see my family or have my mother's memorial. Also, our families have missed a lot of seeing our daughter growing up. So when we started to get interested in coping, what we're interested in is these cognitive and behavioural efforts that we use to deal with stressful situations. So in the MAP study, we've asked participants about 14 different coping strategies, and they typically use in times of stress. And when we asked them during COVID, we asked them specifically strategies that they were using to cope with COVID. And these were mostly grouped into these two categories. So when we talk about approach coping, we're talking about turning our thoughts and our efforts toward the stressor. So typically things like seeking out support, planning ways to solve the problem, or actively changing the way we think about a stressor. And the other set of strategies are avoidance strategies, where we turn our thoughts and efforts away from the stressor or problem. We might distract ourselves, we might use drinking, or we even deny that there's a problem. And the coping strategies that we use depend on how we appraise the stressor. So we ask ourselves things like, is this a great threat to me, or will it cause harm to me? Is it something that I have the resources to deal with? We put a number of statements to the men in our study, and we asked them to rate the degree to which they thought COVID was a threat to them on a 5-point scale from strongly agree to strongly disagree. And here are a couple of examples. To the statement, things will only get worse because of COVID-19, we found a substantial increase from the first survey to the second in 2020, and then rates of men endorsing this statement remained high, albeit with some decline into 2021. To the statement that I worry about what will happen to me because of COVID-19, we saw 1 in 5 to 1 in 4 men endorse this across the 3 surveys that we had. When we asked men to think about the possible harms to themselves or their loved ones, they were more concerned about emotional well-being than physical health, and they were substantially concerned more about loved ones than themselves. I think that might not come as a surprise to anyone here. The concern about their own and others' emotional well-being increased over time, and again, it's important to note here, I think, that men are paying attention to their emotional states. The coping strategies used the most and the least were stable across the waves. Many men said that they were learning to live with COVID, they were accepting the reality of it. They were least likely to use religion or spiritual beliefs as a coping strategy. But really concerningly, I think that over the course of the pandemic, the men increasingly endorsed this item that says, I have been giving up on the attempt to cope. We've so far published one study on COVID coping that uses just our data on coping prior to the pandemic and from the first pandemic survey. And we found that in that study, there were 3 patterns of coping at both time points. We had this group of relaxed copers who don't activate strategies at a high level, they're kind of chill. We have approach copers who engaged in planning, help seeking, positive framing and the like. And then we had this third group that engaged in these positive approach strategies, but they also engaged in avoidance strategies. The third group that we called dual copers had significantly higher levels of mental health problems both before and during COVID. But interestingly, some men changed their groups from before to post-COVID. If they changed from being a relaxed or approach coper to a dual coper who engaged in avoidance strategies, then their mental health became worse. If they changed from a dual coper to a relaxed or approach coper, then their mental health improved. And we think that this finding is really important for 2 reasons. It shows that men do change their coping strategies in the context of stress, either for better or for worse. And secondly, we think it's important to alert practitioners to this dual coping strategy where men look like they have everything in hand because they're engaging in these really helpful strategies, but those strategies actually have no impact on improving mental health outcomes if the men are also engaging in the avoidance strategies. So here's something from another fellow who said, I'm feeling an incredible level of isolation from my team. I'm also feeling a huge burden with having a son doing remote learning. It really sucks, but I'm working through it. So now I just want to quickly turn to our investigation of loneliness. We all know that concerns about loneliness have escalated in the context of things like lockdowns, but even before the pandemic, there was this reason to be concerned and to be concerned specifically about loneliness experienced by men. There was this really big 2020 global study that captured data from 237 countries, finding that men in individualistic societies like Australia, like America, they were particularly at risk. In that, we found that at every COVID wave, more than half of the participants had at least moderate levels of loneliness, and this increased by the 3rd survey. We also used, the UCLA loneliness scale, which is one of the most widely used in the world. And those at the high end, which was around about 5% across all waves, reported always feeling lonely on at least one of the statements, like I lack companionship. We wanted to identify the best set of pre-pandemic predictors of loneliness, because these kind of studies help us identify who might be at risk in future crises, and they also identify possible factors that might be studied further as targets for interventions. And we investigated 25 pre-pandemic predictors, covering everything from things like personality, mental health to job competence. And we used this fancy machine learning approach, which in the end turned out these 4 predictors that were the best combined set of predictors of men's loneliness. So not surprisingly, these included men's prior depression and their personality trait neuroticism, which was associated with high levels of loneliness, and social support, which was associated with lower levels of loneliness. But the strongest predictor was actually environmental mastery, which is this sense within a person that they have some sort of control and the capacity to change things in the world around them, and also in their inner worlds, their thoughts and their feelings. And what I like about this finding is that environmental mastery is a psychological well-being indicator rather than a mental problem symptom. So it suggests a possible target to take a strengths-based approach to supporting men to reduce levels of loneliness. And the final thing that I'll just touch on is help seeking, which has obviously been a bit of a theme that we've been discussing already. We know that conditions for health access changed in a rapid and really pronounced way at the beginning of the pandemic. Major pivot was made to telehealth, and this provided us with an opportunity to see if men's help seeking would also change. And we asked men if they had, in the event that they had a mental health symptom, how likely would they be to seek help either face-to-face or via the internet with a therapist or the internet without a therapist. And when we first glanced at this, it looked to us as though 20% of men roughly were consistently saying that they wouldn't want help at all. But when we dug a little bit deeper, actually nearly all the men in our sample said that they would seek some kind of help if they had mental health problems, but that type of help differed. It differed across the sample. Everybody wanted something, but they wanted different things. We found that men who reported the really severe levels of stress, also measured using the DASS during periods of COVID survey 2 and 3, were significantly more likely to want help face-to-face by the internet. Also face-to-face in comparison to the internet. In fact, those guys with really high levels of stress were extremely likely to endorse wanting face-to-face traditional therapy and extremely unlikely to want any internet support. So overall here, we're busting that myth again that men don't want help. However, we do actually see that we have a lot of fence sitters. And this is where we have an opportunity. It's important that we don't slam the door on these men with our system barriers when they can hesitantly make their first inquiry about seeking help. And I'll just leave on one fellow who did seek help and was receiving help, but he said, it's been easy for me and family and people in my family to do remote calls with psychologists, etc. But we're all finding it very hard to find somewhere private to have those sessions when everyone's working from home. Thanks for that. I'll stop sharing my screen.
Unmute. Great, thank you, Jackie, and thanks to all of you, Jim, Zak, Neil, and Jackie for the many hours that you've spent sort of inside those stories and inside that data to sort of just then come to us and share sort of 10 minutes worth of findings. I know it's both really enriching to hear that, but also doesn't do justice to the amount of time and the stories you could tell, no doubt. I'm happy to take comments and conversations from the floor if you've got something to ask, and I'd really encourage questions to this esteemed panel whilst we've got them, or share. Then either raise a hand or drop something in the chat box. I think I'm trying to sort of pick out what the kind of the overlapping themes are, and I think in very simple terms, the story we're hearing, this also reflects my experience outside of this conversation, is there's a lot of men who've been really significantly impacted in the last 2 years. And there's also lots of really positive stories that have emerged, whether that's about improvement in relationships, or whether that's increased likelihood to access support, the normalization of the conversation around mental health, or that sort of broad optimism for the future, which Jim talked about right at the very beginning. So I've got a sort of couple of questions leaning into that. And the first one is kind of looking forward, which, to each of you briefly, which groups of men do you think we need to be most concerned about? What's this shone a light on in terms of the specific groups of men we need to make sure that we reach out to moving forward? And I'll sort of go back the order we spoke. So back to you, Jim, first.
Yeah, I guess there's probably more detailed academic research there on very specific groups, but there were two broad groups, I guess, identified in our research. One was young men who haven't yet got that resilience that we spoke about, that is, who are naturally more vulnerable. And the other is a cohort of older men who, for something for them something big has changed, so a relationship breakdown, a loss of job or identity, or something like that, and they've hit a wall in that respect. So those are two groups. The sort of young men generally who haven't yet got that resilience to whatever may come their way, but also somebody who's had a really big change and doesn't necessarily have the tools to deal with it later in life.
That's great. That's really helpful, Neil. Jim, what about you, Zak?
I think we'll all probably agree. Both clinically and in our research, it's very clear that young men are struggling. I speak often about the lack of male role models in this space, and how there really needs to be more going on. There's a bit of a vacuum, and positive, healthy masculinities need to be front and center, I think, for them. Identity formation has been key and is key during your teen years and adolescence, and they've lost many opportunities, whether it's traveling, whether it's school. It's that social connection and working out who the hell you are, and how you're going to move in this world has been stripped from many of these young guys. And sadly, what we witnessed, and very early on, I remember I did an interview for the project, because there was a huge increase in the number of young men who were turning to really problematic online groups, and becoming radicalized in one way or another, just based on a sense of community and belongingness that they were really requiring, that they weren't getting anywhere else. So that was very worrying. And I would say middle-aged men always slip through the cracks here, so let's not forget them. New dads and those who lost their jobs, and who were the protector and provider in many traditional ways for their family, to have that stripped, and dealing with 2-3 kids in the house and a broken relationship. It was dire. And so hopefully they are now getting the resources and the help that they were unable to potentially get over the past 2 years, but we need to do better at reaching them.
Yeah, great. Thanks, Zak. Neil?
Glenn, that's like asking me to pick my favorite band.
Yeah, I get it. Well, which is your favorite child? Yeah.
Look, there's a number of things that I think we need to consider. The suicide rates are disproportionate towards men over 85 and men in middle age, and they still not really having their voices heard and their stories told. In terms, just stepping aside from suicide for a minute, we know that mental health issues are often diagnosed in late teens, early 20s, or not necessarily diagnosed, but manifest and then become diagnosed. So I think that's another target group. More broadly, and there's a lot of reasons for why research with Indigenous men has not really got a hold. And I'm not sure if we have any Indigenous colleagues with us, but as majority of us are non-Indigenous, I think that's a tightrope to walk. But I think that's a group that we need to focus more on. And as a general statement, I'm not sure about what other people have experienced, but I really do find that most of the research that we do is with men who are reasonably well connected in some way to some level of support. And it's the men that are not connected that are marginalized more than others, still remain marginalized because we can't access them in research. So we've got to find more nuanced and more clever and more deliberate ways to bring out the lived experiences and the stories of the really marginalized men.
Gotcha. Thanks, Neil. And could I hand the poison chalice to you, Jackie, to pick your favourite fathers or parents?
It looked like Neil, everybody But I have to say fathers because that's the area that I work in. But having said that, Neil, I just want to jump on what you just said there. To me, the people we need to focus on are the people that we're missing. And that's the biggest and hardest challenge, I think, for all of us, that there's a whole group of people that we are not connecting with as either health practitioners or health researchers, or if we are managing to connect with them, we need to hear part of their story that we haven't. We need to forget kind of those preconceptions that we already have about what matters to them and listen for the signals. And I think that finding that we had of dual copers having higher levels of mental health problems, to me, that's a big red flag. What that's saying is that many of these men are presenting to health practitioners with these terrific set of approach coping strategies that make them look like they're doing well. They're actively engaged in problems solving, help seeking, acceptance, lots of different things, but they're also engaging in avoidance strategies that are clearly problematic for their mental health. So we need to look a little bit deeper, hear a little bit further into the stories of men who look like they might be doing all right and that we otherwise might have been missing. I think that, you know, it gets back to that story of when people say, I had no idea he had any problems and now he's gone.
Yeah. Yeah. And could you just, on a technical point, re-emphasize the distinction between relaxed approach and avoidant copers for us?
So the relaxed copers, they're all engaged in strategies, but they haven't really highly activated any particular strategy. And it may be that they're appraising their stresses as more manageable, so they don't need to engage or say, I need to activate a strategy. The approach copers see a problem, see a stressor, and they say, okay, I'm going to get onto it with these particular strategies. And they're not engaging in avoidance strategies. They're just saying, I'm problem solving, I'm planning, I'm reframing positively. Sometimes you can't actually do something, there's no solution, but you can reframe how you think about a problem. There are other strategies that don't actually include activity. But the dual copers, while they're engaging in those things, and partially because a lot of people probably know they're the things that you should be doing, they're also undermining any positive effects that those strategies are having by engaging things like distraction, drinking, disengagement from the problem, denial, things that are avoidance strategies. Yeah.
Gotcha. Fantastic. Thanks for that. And just a request in the chat box to share a link to that research paper, if you would, Jackie. Is Professor John Oliffe still online? If so, could you unmute yourself and say hello? Because I know you've...
Yeah, g'day Glenn, how are you?
Right, I'm good, John, great to see you.
Likewise, yeah.
No, rather than, sorry, go on.
A terrific morning, very good morning.
Right, John's joining us from Canada, and an absolute legend in the world of men's health research. Rather than read out your question, John, maybe you'd like to ask it and also put some flesh on the question as well if you want to.
Yeah, no worries, thanks. Just I'm really buoyed by the data that's presented. You know, it does a really nice job of talking to the challenges for guys in a nuanced kind of way. I do wonder about what a gender relations approach might do to help us get toward remedy. And by gender relations, I mean not sex and gender comparisons, but a triangulation of this data, how that might help us, you know, kind of move forward.
Okay. So, and by triangulation, could you flesh that out for those of us who aren't academically minded and just getting our head around your brilliant question?
Yeah, so just the idea that, you know, you might collect data from more than one source, and you wouldn't be looking for concordance or discordance. You'd be kind of looking to try and fully understand the situation. So, for example, you know, men's mental health rarely takes, or mental illness rarely takes place in a vacuum. You know, lots of people are challenged around them, and I would also say partners who might be experiencing some of these very same challenges in a household might have impacts on guys within
Yes.
that context, as an example. So I'm just trying to pose the question to say, how might we use a gender relations, approach to triangulate some of these insights that might move us towards remedy?
So I might jump in there, but very quickly. Thanks for the question, John. It's a very good one. I think I mentioned, perhaps just as an aside, the relationship between men and boys and the females in their lives. And that was brought home to me very, very strongly when we did qualitative one-on-one interviews where, we were kind of, pushing people a bit and said, what's important here? Is it men's health or women's health or young people or old people? And the very strong answer was everyone, because it may not be me, but do you think I don't care about my husband, coming home and crying into his pillow, or, I see him every night, this thing happened to him. If you think, I'm going to take some sort of gender stance on this, just because it's my husband, not me, then you're sorely mistaken. I worry about my son just as I do my daughter, etc. So that sort of triangulation, whether you mean by those terms or between bits of research to compare the experiences of men or women, is very powerful. And what I'd say is, by extension, the idea of groups being pitted against each other for funding and things really doesn't wash with the general population, which is my particular bit of research interest, is what the public perception and experiences are. They're really just saying to us, look, I'll give you a practical example. I did some message testing and just chatting to people, and if you put a message for example, to people that, hey, women get much more funding than men in health and mental health, this isn't fair, you'll get pushback. And you'll say, well, is it needed? Where's it going? I question this. If you say, oh, hang on, women get more funding here, and actually only 25% of suicides are now women. Something we're doing here is working. There's a tailored solution here that's obviously doing something. Why don't we learn from that and apply it to men? We don't take funding away from women and fight for it. It's not some, sort of identity politics battle. But we learn from this and we get funding for men, and we do either the same thing that we learn from it or different things that are tailored to men. That is manna from heaven. It's not a battle. It's learning from one another and working together. And that's probably, a little bit different to what you meant with your question, John, about triangulation. But I think it's incredibly telling that the population just want these things solved. It's not a battle. It's a battle against mental health. It's not a battle against men or women or old or young.
That's great. Thanks, Jim. And I think it's really important to recognise that in order to translate research into action, at some level, you need public support for what you're trying to do and public understanding of what you're trying to do. Otherwise, you can't get the political support. Zak, your thoughts on the gender relations question?
I'm a bit biased because I work with John day to day. So this is a paid question. Paid out. Gender relations is a topic very close to my heart, and I think beyond. I think we need to very quickly, as a field, move beyond this cross-sectional data. I think that Jackie has done a very good job and is probably one of the only few in the world getting longitudinal data out of men. So congratulations, Jackie. Sell the special sauce to everybody. But that idea of finding different access points to men, and also realizing this is something that we don't do well enough, is the intersectional approach. And when I say intersectionality, I'm referring to what Neil was kind of talking about, which is that we've got all of these groups, whether they be Indigenous men, sexual minority men, and we continue to see them as isolated, when in fact, all of these different factors, low SES, gay, Indigenous, they all intersect, they all meet at a crossroads. And if we only look at these single data points, we continue to lose what is the nuance and the depth of every man's experience. And so what we do, we become very reductionist, and we go, oh, he was gay and this is his answer on this question, and therefore that explains everything, rather than taking into consideration the entirety of his environment and living experience. So I do think that we are a very young field, and John and I always write in the start of our papers, it's a nascent field, and we've gotten away with that for quite a while. And I think it's time to move past that idea towards going, we've got a pretty strong background. Glenn, you've been here long enough. We've known each other too long. And we continue to have a very similar narrative year on year. So I think we're meeting a threshold now for a diversification of knowledge and a realization that we need to do things a little differently in a little more complex ways than we have previously. Because if we continue to get the same results, isn't that the definition of stupidity to go again?
Great, thank you, Zak. Neil, we've hit time, but if you would, I'd love to hear from Neil and Jackie before we wrap up.
Sure. I won't repeat the intersectionality comments. That was going to be my comment. I think one of the things that we need to get better at is moving beyond the binary of men and women, and not just us as in public discourse. And I think one of the things that we've got probably a bunch of researchers that are they're sold on the idea of gender relations and working on the non-binary. How we go about placing that into the broader research and policy context is a challenge, because we've still got people who make decisions about policy and about funding and about research priorities that are stuck in a binary world, and also stuck in a positivist world that doesn't necessarily embrace the voice of lived experience. And so we can learn from other sectors where that's gaining momentum, like you said in the first session, Glenn, and apply that to male health as well.
Great, thank you, Neil. Jackie, for the final thought.
Look, I feel so grateful to be able to speak just after this conversation around intersectionality, because I think it's critical to how we understand the complexities. But as Neil said, we need to be able to convey the message in a really simple way. In the fatherhood space right now, we know that it's always a whole lot of less funding for research on men than there is on mothers and infants. And the way that we step into that is we talk about the family system. And there's not one part of a system that doesn't change on when one other part is affected. So that's either for the worse or for the better. So we need to think about the systems that we work within in terms of ourselves biologically as a system, in terms of our families, in terms of the culture that we're in, and the influences within that culture, and the health system as well. It's extraordinarily complex, and so then we need people who are great at simplifying it so that we can get that message across and move forward.
Great, thank you, Jackie, and thank you all of you. It's been a wonderful morning. Thank you for those of you who have spent the whole time with us, and also thank you for those of you who have dipped in and out and just attended different sections. It's been a fantastic privilege to get such passionate and committed and high quality men's health researchers together, both on the panel and in the audience too. I've learned loads, and just wish we had like a whole day or week just to unpick this one particular area. As always, there's always that feeling of going deeper and only scratching the surface. But thank you for being part of this conversation, and certainly from our perspective, this conversation will be reflected in our final sort of report to the National Mental Health Commission. We won't just be drawing from Neil and Jim's research. We'll also be highlighting the important research that Zak and Jackie have done too. So thank you all. I hope if it's your only session, thanks for being here. Good to see you here. Hopefully next time I see you, it'll be in person and no more on Zoom. But for those of you who are coming this week, just a reminder, men's health and exercise tomorrow, men's health events on Wednesday, Hearing Men's Voices Thursday, men's health sector workshops Friday. So come back for more. We'll officially turn off the recording now with a thank you